All right, well, why don't we go ahead and get started? Welcome, everyone. Thank you for joining us today for our introduction to the new Center for Mental Health Implementation Support. I'm Heather Gotham at Stanford University. I'm the director. I'm a clinical psychologist by training and have been in the weeds trying to do this implementation work for several decades now. One of my close colleagues says that implementation scientists um, aren't really trained. They're really just born that way. The people who like to get in and try and figure out how to make processes work better or solve problems or help people get to where they need to go. So I am really glad to be here. I wanted to introduce my co-presenters today, Ben and Christina and Ricky, if you can jump in and say hi.
Hi, great to be here with you today.
Hi, everybody. Great to see you all today.
Hi, nice to see everyone. I'm here in Seattle, Washington. Glad to see so many people from all over the country and the world. Very exciting.
Excellent. So a couple things that I think have been in the chat, although the chat's kind of flying by, but if you have any questions, please go ahead and use the Q&A pod. Otherwise, happy to have people in the chat and being chatty today. We are just, I think, tickled to show off our work and hear from you. We have a number of poll questions because we want to hear from you who you are and how we can be helpful to you. Why don't we go ahead and move to the next slide? This is just a disclaimer. We're very thankful for the support we received from SAMHSA, but know that this is our work, and always happy to have folks reach out and ask questions, see how we can support you. Next slide. So today we're going to do we're going to do the why, the who, the what, and the how, and just tell you about ourselves and who we are, what we do, and how we do the work that we're going to do. And really, really so thankful and honored to have this role with all of you. So thank you for being here again. Next slide. We're going to start off with a poll question, and Ricky is going to be assisting with the polls today. So what we do here at CMHIS is we help folks prepare for, implement, and sustain programs and services. And the poll question is, what has your organization done related to preparing for, implementing, and sustaining programs that makes you proud? Successes that you've had in doing this work. And Ricky, how should folks respond?
Yeah, so if everybody could please provide an answer to the question in the chat, that would be great.
Would be awesome. Something about the process of preparing for and implementing and sustaining. What things about those processes do you think your organization does well? Ooh, I like it. Adapt to community needs, building collaborative relationships, collaboration with community partners. That's awesome. Relationship building. Some folks are saying specific things they have done, like expanding MAT services, hearing from the community. Support from senior leadership, hugely important when doing this work. Listening with humility, that's something that we all want to be doing as this center moves forward and starts to work with folks. Ooh, data-informed approach, excellent. Collaborating with traditional and non-traditional partners. The perspective that we have here at the Center for Mental Health Implementation Support is that you all are the experts in your own locations and in your own worlds. And our role in providing the services that we're going to be providing would really be to walk alongside and support. That's why support is in our name, right? We're not the experts. You all are the experts. But we have resources and we have guidance. We have years of experience and we have implementation science findings to bring to the work that we do. But we know that you all are the experts and have already done amazing things. And yet there's always challenges. So we're thinking about how we can help support you with those. Next slide. So why the Center for Mental Health Services, Center for Mental Health Implementation Support? We all want clients to have the best care and to be provided the best services. And we also know that there are a lot of gaps in the mental health services system. There are gaps in access to services and access to effective services. There are gaps in access to evidence-based practices and community-defined evidence practices. And there are also gaps in effective services that are delivered effectively. So some folks struggle because of lots of different reasons to provide evidence-based practices, for example, in a way that is truly evidence-based, because it's hard. It is hard. Organizational and practice change is really hard. And we know that many attempts to change practices or to implement evidence-based practices don't work or don't work very well. And there's a lot of struggle that organizations go through. Unfortunately, a lot of the technical assistance or the implementation support that's provided right now is light touch. So it is webinars or one-time trainings. And we know from implementation science, as well as just all of our experience, that those kinds of things don't work, right? Sometimes you think, oh, we want to do something new. We're going to send folks to a training and they'll come back and they'll teach us how to do it and it'll work just fine. And we want that to be true, but we know that that's not how that works. And so some of these things collectively are the impetus for why SAMHSA funded our particular center. Next slide. So Center for Mental Health Implementation Support, CMHIS, brings the how of practice change. So we're different than other TA centers, other of the amazing SAMHSA TA centers that are focused on specific evidence-based practices or that are focused on specific populations or on specific mental health issues. We are focused on the how of practice change. And the work that we do is grounded in implementation science, which is the study of how to successfully prepare for, implement, and sustain effective practices and programs. We're going to be providing targeted and intensive support. So walking away or moving away, I should say, from that light touch support to provide more targeted and intensive support. And we'll define what that means in a little bit. To really try to focus on practice change and not just knowledge and skills change, which are important parts of the process, but we know that that's not all that folks need. As I said earlier, we have a very strong desire to listen, to walk beside you, to help you navigate roadblocks, to not be the experts in all things, but to bring what we hope are going to be really helpful, pragmatic, and accessible resources and services to you as you're trying to do the hard work out in the field. Next slide. Our center, our new center, has two goals. So SAMHSA bequeathed us with two goals. The first is to increase the availability of implementation science-based resources on how to prepare for, implement, and sustain effective practices. So resources. So we're going to be, and already have started identifying resources that are available that focus on the how of practice change, and we'll be developing more as we go along. I really want to say, again, we're focused on the how of practice change and not on training on specific interventions. Our second goal is to increase the capability of Center for Mental Health Services recipients, so grantees, and I know there are a number of grantees who called out in the chat that you're a Project Aware grantee or a TISS grantee or different kinds of grantees. So we serve grantees, and we also serve organizations that oversee or directly provide mental health services, which is pretty much everyone in our field. And so we're going to be providing services, this implementation support to help increase your capability to, again, prepare for, implement, and sustain effective practices. And that could be new practices that you're wanting to start from scratch to implement. Those could be things that you're already working on and maybe having some challenges with. Next slide. So that was the why. To talk a little bit about the who. This is who we are. We are an overarching umbrella organization, CMHIS. We're located here at the Stanford University School of Medicine, and we are 5 bi-regional hubs. We have from the Pacific West Hub right now with us, Christina Clayton, who is a co-director of that hub. And so that hub serves HHS regions 9 and 10. Hey, Peyton. Peyton's in the audience from the Pacific West Hub as well. Thankful to be serving our states and territories. We have a Southwestern Plains hub located at the University of Texas, Austin, and they are serving regions 8 and 6. Oh, this is a good test of my numbers here. We have a Midwest hub located at the University of Wisconsin-Madison. They serve regions 5 and 7. Our Northeast Atlantic and Caribbean hub located at Rutgers serves regions 1 and 2. And our East Coast hub, Ben is a representative, not representative, but director of the East Coast hub at Emory University. So the cool thing about this, another reason I love this project, is we have a national focus, but we also will be providing regional, state, localized services so that we can kind of get down in there with you and provide the support that you need. Love that our staff from our hubs are chiming in the chat. So that's who we are. Who we serve are grantees funded by SAMHSA Center for Mental Health Services and the organizations that oversee and directly provide mental health services. So thinking about, as we were, planning and working over the last 6 months to really start launching this, we were thinking about who are our real target audiences for this. And previous work that we've done, because many of us were in the previous Mental Health Technology Transfer Center network, if you were familiar with that project sunsetted. We are not the new MHTTC. We're different in lots of ways, but that work and the work of many of some anyway, of the other TA centers that SAMHSA funds are really focused on individual clinicians and staff. Those are the people doing the implementing. Those are the people providing the services. But we think that the services we're going to be providing, again, focused on the how and practice change and organizational change, that probably our key audiences are more like system leaders and administrators, people responsible for leading implementation efforts. So the folks doing the implementing, the managers, the clinical directors, program directors, quality control folks, the people who the leaders come to and say, we need you to lead this organizational change for us. You're going to be in charge of this new initiative. We're going to implement this new effective practice. You are our people. You're the folks that we want to connect with and help. But also policymakers and funders. So we'll work with states, state departments, and tribal governments, and organizations providing training and technical assistance. So I know we have on the session today a number of our colleagues from other SAMHSA funded TA centers, and we're excited to work with you as well, both as colleagues, hopefully to provide implementation support, and if there are services and resources we have that can help you do what you do even better, we're excited about that as well. So a little bit about who we serve, and now we want to hear from you, I think, on the next slide. As we think about these are who we think our audience is. So let's hear from you, which one of our audiences you represent.
Yes, and we're going to go ahead and launch a poll question for you to respond to. So we will ask you to please choose the choice that you feel best represents you. And we'll give everybody about 30 seconds to complete the poll. All right, we'll give everybody about 10 more seconds to get their option in. All right, we'll go ahead and close the poll now. And here are the results. So it looks like we have a pretty wide spread. Most seem to identify as people responsible for leading implementation efforts, and also organizations providing training and technical assistance. And it looks like we also have a good number of systems leaders and administrators, as well as individual clinicians and staff with us.
Excellent. It's great to have you all here. Thanks for joining us. Yep, certainly some folks fall into all or multiple of these. All right. Wanted to talk a little bit about what we do and what do we mean by the how of practice change. So you can think about this process of implementing an effective program or practice as going across a continuum or a process from when you're just starting to think like, are we really serving our clients and patients and consumers the way we want to? Maybe we need to do something different. Let's think about, select, and prepare for doing something new through the implementation phase where you're really trying to do that new thing and do it well, all the way through maybe a couple of years out when you're trying to figure out how to sustain the service. So this is a well-known and certainly many times rocky process over time. We want to provide support across this whole process. SAMHSA has gifted us 8 specific topic areas, core topics within this within these processes that we're going to provide support on. So I wanted to walk you through just a few of those, and you'll see those come up again as we move forward. But these are really the key, the core topics, we call them the guideposts, and the topics about which we'll provide resources and support. We hope that as folks start thinking about or preparing to do something new or different, that they really start by engaging the community in thinking about the services that are provided already in the community, in working with behavioral health agencies to plan services. I know a number of you, when we asked the first poll question about what you do well or what you've done well, talked about those kinds of collaborations and engaging the community. That's so key. And we know that if we don't engage the community on the front end and get their buy-in and understand what their needs are, then whatever it is we implement is not going to go so well. So engaging the community is really important. And then assessing their needs. So a community mental health needs assessment is key to understanding where are the gaps in the community, what are the true mental health needs, and what are the services that are already being provided. We hope that folks use that information then to identify factors that influence implementation. And this includes selecting a new practice, an effective program or practice. It includes identifying what are the barriers and facilitators to implementing this actual practice within our organization. Are there things like stigma, which was noted in a Q&A question a little earlier? Do we have the organizational resources to provide this? Do the staff have the training? Do we have the right staff? So those factors that influence implementation are really important to identify. And then think about what support do we need? So now that we know the practice we're going to be implementing, we have a sense of what the barriers and facilitators are. What supports do we need to implement the new practice? And these are called implementation strategies or implementation support or technical assistance. These are the things that we do to help people implement the new practice. And those strategies should be really reflective of what those barriers and facilitators are. One of the next steps in the process is to think about using clinical progress to guide treatment, or this is called measurement-based care. And Ben's going to be talking about this in a few minutes with an example of some resources that we have identified and developed related to measurement-based care. But how can we understand at the patient level how things are going from session to session or from month to month? A next and important step, and these are arrayed out as if this is like a great continuum where you go from one step to the next, and with all stage models, they're not necessarily in this order. You might get to one and then have to go back to a previous one. But 8 guideposts here. So marketing programs and services. Sometimes community mental health centers have a need to get the word out about the services they're providing. So if you're implementing a new evidence-based practice, for example, how do you let folks know? And so there's some great communications and social marketing strategies based in implementation science that we'll have resources for. The next topic here is using data to improve service delivery or continuous quality improvement. So once you've kind of gotten through those early implementation phases or stage, and you're kind of starting to hum along, you can think about how can we do this better? Or how well are we doing this? And so continuous quality improvement is a way to incrementally make sure that the services you're providing are of high quality. The next core topic is evaluating program outcomes or program evaluation. Something that we have services for and resources for, really helps to be able to think about what's the effective program or practice that we're implementing and how can we design some program evaluation specific to that service. And then sustaining service delivery. Hey, we had a grant. It was great for 3 or 5 years or however long it was, and the grant's ending. How do we sustain this? How do we keep this going? How can we develop a sustainment plan or sustainment action plan to understand what resources we need and what things we need to do to keep this moving over time and maintain it? So that's super quick, I know, but just a snapshot of some of the kinds of topics that we'll be providing resources and implementation support on as we get moving. So as we walked through those pieces, I'm sure you were all thinking about examples of times when you have been preparing for or implementing or sustaining effective practices, or you're thinking about what your organization is doing right now. So would love you to think about, where does your organization most likely to get stuck? How are we going to do this one, Ricky?
And we're going to launch another Zoom poll for you all. So we're going to ask you to choose the one core topic that we just talked about where your organization is most likely to get stuck. So go ahead and take some time to complete this poll now. We'll give everybody 30 seconds.
We'll be providing resources and services related to all these 8 core topics, but would really love to know from you, like, where are the pain points? Where are the things that keep you up at night? We'd like to understand this so we can better design services for you.
All right, looks like we're about halfway through. We'll give everybody about 10 seconds here. All right, we'll go ahead and close the poll now. And here are the results. So we have, it looks like sustaining service delivery was the most frequently chosen topic, but we do have some responses across the spectrum here. Implementation strategies was one popular choice. Another one was continuous quality improvement, so using data to improve service delivery.
Excellent. This is really helpful. I know a lot of people are thinking about sustainment right now, given what's going on in the world, and some uncertainty about funding continuing. So that's a really important consideration. Thank you for completing that poll. All right, why don't we switch over to talking a little bit more specifically about what we do. I talked about kind of the topic areas, but what are we actually going to do? What are we doing related to these? And I'm going to turn things to Ben.
Sure. Thanks, Heather. So over the last 6 months, we've been very busy. As Heather said, we've both the hubs, but then also a group of 35 experts have been working at these 8 core topics. The experts include leaders in implementation science, effective mental health practices and programs. And each of the work groups has been developing a set of practical, accessible, implementation science-based resources. So these include overviews of the topic, tools that can be used both for the hubs in providing TA, but also for the field more broadly, guidelines, references, and then we will be developing other more in-depth resources as we move forward. Next slide. So I've had the privilege not only of working with the East Coast Hub, but also co-leading one of these groups, measurement-based care group, which remember is about using data at a clinical level to guide treatment. And I've been working with my co-chair, Sandy Resnick, who's a real expert in the area, as well as a number of other experts, as well as staff from CMHIS. So we had two goals for our work group. First, we have developed and vetted a list of patient-reported outcome measures, which are called PROMs. Those are kind of the engine that drive measurement-based care. And that is available now for anyone who wants to take a look. It's kind of a menu of measures that an organization can choose from. They include symptom measures, functional measures, as well as strategies for developing more individualized goals. And then we are also have developed and are developing more resources, both to guide CMHIS staff in providing intensive TA around measurement-based care, but that will also be resources for the field. So yeah, so we're excited to have been able to do that.
All right, I guess I'm up. Thanks everyone for being here. Really have had the pleasure of working with a lot of these folks in our prior grant, but to do something like this where we actually dive into what is actually helping or hindering practices get out in the field and be sustainable, be effective, has been very, very rewarding, and it's really shined a light on some of the things that people have shared in the chat, as well as in the questions. So our work group relates to factors influencing implementation, and factors really covers a lot of ground. We are doing, you've been doing an internal series on these very things, and when you talk about what facilitates or hinders, gets in the way, what can help things get pulled off in a good way, it really runs the gamut. So why is it important to think about this topic? So we know that when you go to implement a change, a new program, a new practice, that really these are things that a lot of people spend a lot of time examining and identifying. And if you can identify what they are in the beginning, you can try to find strategies to really mitigate or enhance the beneficial parts that you have to really make your success, happen with this implementation. So I've been really honored to work with Dr. Lydia Schwastiak and Dr. David Katz around this topic. And we can really affect change if we can figure out what these are and what do these even mean. We've kind of touched on this, but I think to the question in the Q&A, it revolves around the practice or program we're doing. It revolves around the people that we are serving. It revolves around the people delivering the practice or program. And then you have the agency or organization, and then you have the systems and communities. So that's what this work group and this set of resources really tries to address, is how to dig into and understand what you're facing as you're trying to implement. So you're not surprised and you can anticipate where you need to put your resources. So with that, I'm sure the link is in the chat. There it is. All right. Thanks.
Thanks, Christina. I was just reflecting on the comment in the chat from our colleague from India who's talking about understanding the unique challenges within the country's diverse sectors. And I think some of the resources that were identified by your work group are really international and able to be applied, because they're really asking folks to consider their local context and then talk about what are the most important factors, the most important barriers and facilitators within their context, and then try to prioritize them. And I would hope that kind of exercise is really useful and kind of beneficial internationally as well. We're going to talk a little bit more about how we do the implementation support. And we have one, I think maybe this is our last poll question, about the secret sauce. So if you think about technical assistance or implementation support you've received in 1 or 2 words, what's the secret sauce that made it most effective or helpful for your organization? Ricky, tell us about this poll.
Yes, so for this poll question, you can access the poll by going to the link in the chat, or you can scan the QR code and type in your answer. And for this question, it is going to be a word cloud visualization. So we'll navigate to that screen and see how people are responding and get a sense of what the secret sauce is across our audience today.
If you want to think about what made that TA that I participated in, or that training, or that professional development, like what made that really helpful and useful? Why did that seem to go so well? I really got a lot out of that one. I'm sure we can all think of examples where we're like, no, I didn't need to sit in on that. But how about the good ones? What did the good ones do that was difficult?
Some folks are saying they can't get into the poll. Mine is also saying that.
Someone
Oh,
said,
skip for
Yep,
now. Got
skip.
it. Yep.
skip
There
for
you go.
now.
Yes,
Let's
click
skip.
skip for now.
Click skip for now. We don't want folks to struggle. If you're having difficulty, then just put your answer in the chat, and we'll be excited to record it there as well. I'll pop the oops. Want to make sure that we're getting folks' information. So this is great. Personalized. I'm seeing support rather than, directives. I'm seeing folks talk about leadership, about practical, tailored, responsive, interactive, guides. And in the chat, we've got some similar things: specific, actionable supports that's efficient. Ooh, something where we changed dysfunctions. Oh, we all wish we could do that, don't we? Support after the initial training, so that kind of ongoing support. Empathy and caring. The team effort. Great, thank you. These are the things we're going to strive for, and you're going to hold us accountable if this work doesn't go as we plan. But that's what we're after here. We're really trying to provide support that is accessible, that is pragmatic, that isn't like pie in the sky or Pollyanna, but that is really things that people can use. You'll notice, for example, our resource library on our webpage is not like chock full of 1,000,001 resources for each of the core topics. For example, we have curated, very particularly curated down to just a few of what we think are the most important and relevant and pragmatic resources. So the resource library will be growing over time, but again, we wanted to really hone in on the things that were most pragmatic. So a little bit more about what we do. We were talking about resources, and Ben and Christina shared their work groups, the work that their work groups are doing, and the resources that they've identified are in that resource library that Christina just put in the chat. So that's the resource development side, right? That was goal 1 from our project. And goal 2 is providing this targeted and intensive implementation support. We're going to leverage those 8 topics. We're going to build and maintain those collaborative relationships across the US and in the hubs and in there by regions. The CMHIS as a whole has a consultative monitoring board, an advisory board made up of national leaders, and each of the hubs has a bi-regional advisory board. We're conducting a national needs assessment right now. We're going to give you the link in just a second to help us know what you need and what you want by participating in that national needs assessment. And then also we take it as a responsibility to develop a coordinated approach for how we provide implementation support. So we're looking at implementation science again as kind of the bedrock or foundation of what we do. And we're looking at delivering implementation support that is in itself evidence-based, it's evidence supported. And we are going to, for example, match the implementation support strategies that we provide to the local context or stage or audience. So I think sometimes support is provided by like, oh, what are you implementing? Okay, we'll do a training because we know how to do a training, or we'll do a learning community because that's what we know how to do. But we want to be more strategic and thoughtful and again, evidence-based in the kinds of support that we're providing. So I see there's a question about the National Needs Assessment. I think is that their next slide? Here we go. We're conducting a brief National Needs Assessment survey to understand what your needs are. So there's some questions in there about the 8 core topics and what kinds of support you need or would like to have. We're going to use the results of this to develop what we hope are more impactful resources and services. So there's 2 different surveys. There's one if you are a SAMHSA or other funded TA center, a technical assistance center yourself, there's a survey for you. If you're from a community-based organization or are a leader at a state or a county or a local government organization or kind of any folks in that area, then there's a specific survey there. So don't feel like you need to fill out the survey right now while we're talking, but the links are there, and we'll certainly be sending this out to you all after the session today. But we'd really love and appreciate your support in telling us what you need. And please also feel free to share these with colleagues. Okay, so I keep talking about this targeted and intensive support. What does that mean? So we can think about, again, technical assistance or training or what we call implementation support is kind of being in a couple different levels. All of these you've probably participated in, but we think it's important to think about what are the goals of each of these types of support. So if we're just building awareness and knowledge, and all of these are important parts of the process, but we call that information dissemination or basic support. So come to our website and get information. We have social media started on LinkedIn. We're going to send out newsletters, and those are important ways to get information out, but that's about kind of where they stop. So targeted and intensive support are more directed, more customized, and targeted support are things like didactic workshops or learning communities, a learning series focused on skills building, or an online course. And then intensive support are things that are very customized and ongoing consultations to really support practice change. So you'll see a lot of this from us: learning collaboratives, ongoing consultation, practice facilitation, and coaching. So we recognize that sometimes it's a bit of an ask to ask you and the audience to participate in these more intensive services. We're going to try to work really hard with folks to understand, again, what are the needs and what are the limits of what you're able to participate in. But I wanted to give kind of the rationale for, we might be providing these services that are more intensive. We think that's really important in order to get to that goal of practice change. Next slide. I want to turn things over to Ben to talk a little bit about some examples of the kinds of support that we can provide.
Sure. Yeah, just to sort of make things real, we'll give you a couple of examples of things that are already in progress, and then a couple of things that are kind of more hypothetical examples. So the East Coast Hub has just begun a learning community, succession learning community for aware grantees to develop and enhance the sustainability of school-based mental health systems. Remember, Heather was saying how central a question sustainability is, particularly these days. So the The audience are either current or former Project Aware grantees, other school mental health leaders, and it's really providing them with resources, as well as support and a forum to share best practices. The Midwest Hub is launching a continuous quality improvement change leader academy. This is providing implementation support across multiple sessions. It's for mental health organization leaders within a state, and it will be providing work group materials around continuous quality improvement. Next slide. So just to give a couple of other examples of how things can work. For instance, if there were an evidence-based practice that a community was working with around existing toolkits, CMHIS could provide implementation support. So an intensive, say like a learning collaborative with community mental health centers, and that would incorporate a bunch of those different guideposts, those core topics that we talked about, in order to provide support for the community mental health centers to implement the evidence-based practice. So not the training around the evidence-based practice, but helping the community mental health leaders to be able to implement that practice. Another example we frequently hear from community sites that they want to be able to do a better job of evaluating and sharing what makes their program effective. So we could develop an online course, for instance, to help those community leaders do a better job of being able to evaluate and then tell the story about their program and what makes it effective. Heather, do you want me to do? I can do this one, sure. So we're very excited that we are currently in the early stages of planning a learning community for leaders, again, recognizing the current landscape. What does it mean to be able to implement effective mental health services in these challenging times that we're working in? So this would be targeted at managers or leaders or supervisors within mental health organizations, or implementers, so people who are kind of needing to develop, implement, and sustain practices. This will equip mental health leaders with tools to drive meaningful change. There'll be practical strategies to prepare for, implement, and sustain practices, and it will combine, some teaching from our part, but also peer learning opportunity for folks to work on projects in their organizations. So this will, we will be beginning the process with applications. They're very brief, but just to figure out kind of who it is who would be participating, and then those would be due in mid-June, and then we will be beginning the learning community in mid-July and running through the middle of September. So we're very excited about that. We think this is an opportunity for both to begin working with you and to be able to begin solving some real world challenges that you guys are facing.
All right. Thanks, Ben. I think the goal with this learning community is really to connect with everybody. And I've seen a lot in the chat. Oh, I work here. I do this kind of thing. Would this apply to me? I mean, I think, you can read more about it. And I think learning for everyone how this program from SAMHSA is different. And it's really, as you said, multiple times, Heather, it's really supporting you all doing the great work that you're trying to do in a way that really helps it be successful and helps it reach its target. To have, to Kate's question, excuse me, sorry, someone else's question that was in the Q&A that's answered now, who asked about equity and peer perspectives and all of that. It's really, I think a lot of that is contained throughout a lot of the resources. And, when you did the word cloud, we saw a lot of words around, tailored or specific or personalized. And I think that's really important, that we obviously want to provide a lot of support that has wide reach, and, anybody can go to the resource library, but then we also will be doing this more tailored support. So how can we help you? What does this look like? So what we're doing is helping organizations prepare, implement, and sustain, effective mental health prevention, treatment, and recovery practice programs and practices. They need to be community-based services. And so on the flip side, as mentioned, we don't train on specific practices or programs. So it's not the evidence-based practice or the community-defined practice that we'll be training you on. We will be helping you implement that and help that goes off successfully and hopefully is sustained into the future. We don't help around direct aid to obtain funds or a specific grant or type of project. And we don't do support to implement a new, level of care. And so hopefully that makes some sense. But, part of what we're doing with this informational, sharing event today is to get the ball rolling, get people thinking about if some of these things start to strike you as things you've encountered and things that you would like more information on, to see if something you're experiencing would fit for a project. So the next slide will talk about how you can reach us. So I think Ricky will probably put in the chat how to reach our request support page of the CMHIS website. But there's a couple of ways you can do that. So you can click the request support button, and it will actually take you through a pretty easy, user-friendly form to share a little bit more about what your questions are, what your needs are, what you're looking for, and get some gauge on if this might be a good fit. And then also you can do a contact form. So if you have general questions, there's also ways to reach out to specific hubs. So obviously Ben and I co-direct different hubs. You can also find on the hub page how to reach out to those folks as well. So we aim to be responsive, whether you're, submitting a contact form or a request form on the website. You'll receive a response in a few business days. And some responses could include things like we might provide a resource. Sometimes we get a question, and this has certainly happened, that doesn't exactly fit what we are able to do or know how to do or are charged with doing. But if we will do everything we can to find a resource either from SAMHSA or some other place that is vetted and that we know is a trusted source of resources to try and connect you. We may set up a time to chat about tailored support. So having a conversation, doing that exploring and kind of consulting about what is it that you're looking for and what are we able to provide is another option. And then, like Ben just described, we might have an upcoming activity that you or your organization could join. And certainly the hubs will be offering things like that, as well as the larger CMHIS. So there are a variety of ways. I think, we wondered if we would get overwhelmed with contacts when we launched. And I think, we're just really getting the word out through a variety of ways. So we're really excited to hear from you. So please reach out. If it's not something that fits, we will talk it through with you and try to find alternatives. But it really helps us know what you're struggling with or what you're looking for. So please reach out and get in touch with us. We'd really love to hear from you. And here's how you can do that.
Yep, as Christina said, here are a number of ways you can connect with us, from the QR code to going to the website. We would love folks to register on the website, which is the way to join us and sign up to receive our we will not spam your inbox, but to receive updates from us periodically, including a newsletter that we'll be starting in the next few weeks, information on new events and new resources. Again, you can contact us through our contact form, and we have a new LinkedIn page as well, or I don't even know how to talk about social media, a new LinkedIn account as well. You can connect with us there too. All right. Next slide. I think that was it. We're to the point of if there are other questions, if you want to put in the chat or ask in the Q&A pod. I have responded to the folks who had asked questions in the Q&A pod, but if you have other questions. Oh, hey, yeah.
I was going to say, we want to show this one.
Super important. So this is like, the overall CMHIS, a welcome to the neighborhood, talking a little bit about the hubs, but the next and really cool thing is our hubs are each hosting an open house in the next week, some as early as tomorrow. So if you want to get more information and more specific information on the localized specific resources and work available from our amazing bi-regional hubs, please go ahead and register for one of the open houses, the open house that fits with where you live or where you do your work. We are excited to have folks send these. We're going to send out all the slides. This is also on, if you go to our website, there's a news item about this and the hub open houses, and you can get the registration links there too. Thank you, Tawny, for saying that. We miss the MHTTC network as well. We miss it. We did great work there, and we are excited to be doing this new thing, and hope that this will be just as amazing, if not more so. Christina, I'm not sure if you have a response to Tawny's question about evidence-based treatment service TA or training that's in the Seattle area.
Yeah, Tawny, if you wouldn't mind, we'd love to get in touch with you. We did create something as we wound down our MHTTC, so I will put our hub page. I did want to make sure, are we able to put the registration links? I think they were in our slides, but yeah, sign up for the open house. Thank you very much, Peyton. So we'll put our hub contact, but we can send you what we know about when we wrapped up our MHTTC. So hopefully, yeah, I'll get us your contact stuff. There's a few things lingering out there.
And to say, sorry, Christine, I wanted to say there's been a couple questions about other places to go for TA, and I know we have many of our amazing colleagues from other SAMHSA funded TA centers. So SAMHSA has a great practitioner training webpage. It's also, if you go to the bottom of our webpage, you can get a link to that. But there are great resources and trainings available on the what, or the specific evidence-based practices, from places like the SMIT TAC and the HHRC, the Center of Excellence for Nursing Facilities, the E4 Center of Excellence on Aging, and all those great places to get resources and specifics on the what. And thank you, Ricky, just put in the technical assistance and training directory. Yeah, it does have, if you haven't been there recently, it has a cool filter system.
I did see a question Anna asked. So this is primarily for researching current patient care data and other data. You do not assist with new services of organizations just starting. So I think to be fair, just for anyone who's still on the call, I would say if you're not sure, like, reach out to us, fill out a contact form, because it's so hard to cover all the different permutations in a live event with such a large number of people. Obviously, we're not even face to face with you in the same way, but if you have a question, please reach out. We're really happy to hear where you're coming from, what you're looking for what you're needing resources on, and we'll do our best to try and assist and learn more as we need to. So, and I don't think we have any contact centers in. I'm just seeing the answer about Indian cities in the Q&A.
I think going back to what you just said, Christina, and I may have misspoken, but I was trying to get a point across the point that if you're just starting off wanting to implement something new, we can assist with that. If you're struggling at implementing something that you've been trying to implement, we can probably work with that as well.